Hi all, today we'll discuss the proper technique for examining the cervical lymph nodes, a key part of head and neck examination. The patient should be seated comfortably with their necks slightly flexed to relax the muscles. Always begin with inspection, looking for visible swellings or asymmetry in the neck. Then proceed to palpation using the pads of your fingers in a systematic sequence. Start from behind the patient and palpate the submental nodes beneath the chin, followed by the submandibular nodes along the jawline. Move laterally to assess the preauricular nodes just in front of the ear and the tonsillar nodes at the angle of the mandible. Next, feel for the supraclavicular and deep cervical nodes along the anterior border of the sternocleidomastoid, which lie within the anterior triangle of the neck. To palpate the scalene nodes, place your index finger between the sternocleidomastoid muscle and the clavicle. Ask the patient to tilt their head toward the same side to relax the muscle, then press firmly downward toward the first rib. These nodes are clinically significant because enlargement, particularly on the left side, may suggest intrathoracic or abdominal malignancy, such as a gastric carcinoma. Next, move to the front of the patient to examine the posterior triangles of the neck, running your fingers along the posterior border of the sternocleidomastoid muscle and up the side of the neck. Finally, palpate the posterior auricular nodes located behind the ear and the occipital nodes at the base of the skull. Throughout the examination, assess for tenderness, consistency, mobility, and size. Tender, soft, and mobile nodes often suggest infection or inflammation, while hard, fixed, and non-tender nodes raise suspicion of malignancy or metastatic spread. Always compare both sides for symmetry and note any generalized enlargement that may indicate systemic disease. In summary, a careful, systematic examination of the cervical lymph nodes from the submental area to the occipital region provides critical diagnostic information and should always be included in a thorough clinical assessment. Thank you.